And now it's Deborah Kobylt Live.
Hi, everybody. Thank you so much for joining us today on our show. And please welcome Dr. Malcolm Lesavoy, a board certified plastic surgeon and also professor of plastic surgery at UCLA Medical Center. And boy, have we got a lot of stuff to talk about with you, doctor, because, especially in my age category, right? There are so many people looking to maybe get work done and they don't know where to go. Very often, I live on the west side of Los Angeles. There's no shortage of where to go and possibly who to call to go and get some work done. But very often, it's not so easy. We talked off camera. How do you start to do your investigation on who to go to for plastic surgery?
That was a very good question, and thank you for having me, Deborah. I enjoyed talking to you. Yeah, it is a difficult situation. I think first of all, it's good to understand that plastic surgery is not just aesthetic surgery. It deals
Right.
with many other aspects of surgery and patient care. We deal with trauma, facial fractures, hand surgery, um, craniofacial anomalies, children that are born with cleft lips and cleft palates, and so on and so forth. Deal with cancer, reconstructing cancer, breast cancer, and things of that sort. But most people, when they think
Mm.
about plastic surgery, they think of aesthetic surgery. And
Right.
um, and your question is a good question, and aesthetic surgery is what everybody kind of looks for. To find a good plastic surgeon, first and foremost, one should uh, listen to their own private doctor, and they usually know good plastic surgeons in your particular area, wherever you are in the country. And then you should check that doctor out and make sure that he is certified by the American Board of Plastic Surgery. There are a lot of
Mm.
people that claim that they're plastic surgeons. For example, here in Los Angeles, and if you looked in the yellow pages under plastic surgery, I don't know if anybody knows what yellow pages are these days, but you look under plastic surgery and 30–40% of those people are not plastic surgeons. They're either
Wow.
dermatologists or gynecologists or ear, nose, and throat doctors, and they all call themselves plastic surgeons, but they're not certified by the American Board of Plastic Surgery. And I see very frequently patients that come that have had aesthetic surgery done by non-certified plastic surgeons or people that call themselves plastic surgeons, where we have to fix. So
Wow.
basically, I get a lot of my referrals from other doctors whose patients are looking for an aesthetic procedure or looking to have a plastic surgeon work at them. It is
Mm.
interesting, however, that a lot of it is friend referral,
Hmm.
and I get a lot of referrals also from local hair and makeup people and situation like that. And but a lot of times those hair and makeup people don't know who real plastic surgeons are. So it's a good question, a very good question, a difficult one. But I
Mm.
really encourage the public to really check out their doctor and not just listen to the receptionist when they ask, is your doctor a certified plastic surgeon? You should look up the American Board of Plastic Surgery, which is in Philadelphia, and you can tell whether or not that doctor is board certified. Does that mean you're going to get a fantastic doctor? Not necessarily always. We always have rotten apples in every barrel, but at least with reputation, and at least you know that the doctor has gone through all that training, which is the longest training of any specialty in medicine and surgery to be a plastic surgeon.
Now I'm going to personalize this a little bit. May I?
Yes,
Um,
ma'am.
Two situations happened to me about 10 years ago. I had to take my son in to a plastic surgeon because he cut his lip all the way up to here, right? And I thought, oh, we don't want that just to scar on its own. So we took him into a plastic surgeon. And this surgeon, very nice person, as he was, stitching up my son, he looked over at me and he goes, I could fix that. And I thought, fix what? And he was starting to point to different areas in my face. And I thought, oh my gosh, I thought I looked pretty good. I haven't done anything, but maybe it's time. And I was terribly insulted. Needless to say, it's 10 years later, I've done nothing, absolutely, truly nothing. And then there's number two that frightened me a little bit. When I was a kid, I remember seeing the ladies, they always appeared to be the wealthier ladies in town, super pulled back. And I would think, whoa, I don't want to look like that. So somebody like me, who is, let's just say, over 40, maybe even over 50, I wouldn't mind doing a little something, but I don't know where to start because I have a trust issue. So I'm not alone. I can speak for so many of my friends. Where do we start? Like if I come to you, what would you say to me? Yeah, how would we start that?
Oh, that's a good question. Um, it's a very common question.
Mm.
I would also suggest, um, I see this all the time. Patients come in because they're referred because they've heard of my reputation or whatever, or their friend had a procedure done by me, and they'll come in and they'll say, like you have just said, uh, what do you think? What do I need? What do I need? I said, well, what you need is an idea of what it is that you want.
Mm.
I've been in an elevator sometimes when there's another doctor who's not a plastic surgeon, and somebody comes into the elevator, and the doctor will take out a card, give it to the person, say, "You need to have your
Oh,
nose done. You need to have this done." That's about as lowest class as you could possibly imagine, and it is
horrible.
insulting. It is insulting. It's
Yeah.
terrible. It really is terrible. I refuse to do any procedure on a patient who says this is what I want, and I see or ask me what is it that I need, I will never tell them, never ever,
Yeah.
because they'll never be satisfied. What is it that
Interesting.
you're concerned with? And the point
Right.
is that if you're concerned with your jowls or you're concerned with your neck, then it's something we can start to talk about.
Okay.
Um, but that is the key. Um, but somebody that pushes a procedure on somebody, for sure, you just want to thank you very much and walk out of the
Yeah. It even recently happened to me with a dental surgeon. And he talked about everything that I need to have done. And that scares me. I'm not the kind of person to sign up. I'm the kind of person to walk out and never come back because I
office.
think,
That's
I'm not,
exactly the point.
and that's the same thing if I go buy a car. If you're trying to sell me something I didn't come in for, I'll walk out the door too. So, but
Right,
because of that, I've never done anything because I don't want to look too
of
weird.
course. And to answer your
So,
question, your second
yeah.
question, which is, we see patients that look as if they've been standing in front of a wind tunnel. That's about as disgusting as you can possibly imagine. Um, in my patients, or in any good plastic and reconstructive surgeon, uh, after a facelift or a neck lift or an eyelid or something of that sort, I tell my patients that if you, about a month after the procedure, and you see a friend or you're at a party or something like that, and your friend says, "Oh, Deborah, you really look good. Did you have plastic surgery?" You come back and shoot me because that's terrible. That's a terrible situation for me. However, what they should say, hopefully, if you've had a good procedure done, Deborah, you really look good. Did you just come back vacation? Are you getting more sleep? Did you change your diet? Are you playing more tennis? What is it? I can't tell, but you really look good. You look healthy. Bingo. That is exactly the procedure or the way that we would like for you to be.
Oh, that's
And the point is also is that I have this saying, so to speak, that not just me, but many, I'm sure everybody has heard it. Says, look good, feel good.
yeah.
And so, if you're looking good, it's like when you get a brand new dress, and it really feels good on you, and it fits you well. You feel good, and your appearance also in aesthetic surgery. Anyhow, we're not talking about trauma or cancer or things of that sort.
Right.
But if you have something done that makes you look a little bit better, a little bit younger, a little bit more rejuvenated, a little more rested, and you feel good. So look good,
Mm.
feel good.
What about some of those questionable surgeries? Do you do butt enhancements?
Very, very few. I
Wow.
personally think they don't look natural. Therefore,
Yeah.
that's the reason I don't do them. Also, they can be dangerous. It has been improved over the years, but I don't I don't like to do it. And patients that come in um, uh, that want that particular procedure, I usually don't do.
Yeah. What do you specialize in? Let's say again, I come to you, and what's more common nowadays? Is it the neck, or is it the eyes? Is it the entire facelift?
Yeah.
Breasts. I know tummy tuck, mini tummy tuck, vaginal reconstruction. I didn't even know there was such a thing. So, what do you specialize in? All the above?
I do all the above, every single
Mm.
thing, every single thing. Otherwise, I get bored. And I think the more things that a good plastic surgeon does, the better he is at all these things. If
Yeah,
somebody says, all I do are noses, that's all I do are noses. Well, that's a very limited surgeon right there. And to
yeah,
spend all those years in training, about 18 years or so in training, and just do one operation is such a waste of that person's talent. But I do everything. However, I
mm,
can say that recently, especially with Zoom now, there are a lot of women and men who come in and say, you know what, I'm looking at the Zoom screen. I see my neck is dragging here. And I really didn't worry about it before, but now I can see that other people see what I'm talking about. And so I'd like
hmm,
to go in and speak to somebody about having my neck done. In general, the neck is usually the first thing in the face uh, because of um, because of gravity that many patients are concerned with. I have to also caution, though, that sometimes women and men who are in a relationship and then they get divorced or whatever, they say, "Okay, I'm going to get a facelift, and I'm going to get my neck done, or I'm going to have my breasts enlarged, or something of that sort, so I can attract a new partner." That never is going to work. It has to be
yeah.
for yourself, not for anybody else. Men who are, in their late 40s or 50s or even 60s who are looking for a different executive job. They think, well, if I get a facelift or a neck lift, I'll look younger. The company is going to hire you for your qualities, not for your appearance. At least a good company will. And the same thing true with relationships, men and women. A woman just gets divorced, or sadly, her husband dies, or something of that sort, and she wants to have a facelift or a neck lift because that will attract the man. No, what's going to attract the man is their heart, is their brain, is their kindness, and so on and so forth, not their appearance. Now that can
Mm.
help, but it's just part of the equation.
I love that you said that, because your reputation is as being a truly compassionate and kind doctor. A little bit about your background. First of all, you are an animal rights activist. I love that about you. You have also traveled the world treating children with life threatening and disfiguring conditions. So you're not into this business just for the plastics. You're into it to really help people and make sure that they feel good about themselves first. And I applaud you for that, because not everyone in this field is like that. So thank you.
Well, thank you. It's definitely self-fulfilling. I mean, it's a shame for someone to waste their talents or their training necessarily, or their desires to just do one particular thing. But one of my most favorite things is going overseas and operating on babies and children with various congenital anomalies, cleft lip, cleft palate, as I said, hand deformities, because we do hand surgery also to fix some of those. Unfortunately, now pretty much I have to make a living and stay home and do
Yeah.
aesthetic surgery, uh, which is uh, which is fine, and I enjoy it. But if I had a couple $100 million, that's what I would do. I have one of my former residents who was the chief of plastic surgery at one of the Kaiser hospitals here, was able to retire, and that's what he does: travel and just do congenital anomalies. It takes teams. It's a absolutely fantastic thing because he's doing
Mm,
so much good. Because every single child that he does, then it is exponential what he's giving forward.
yeah. Yeah.
So that
That's beautiful. Well, you've done your fair share of that, certainly, and maybe someday you'll get back into that when you're able. But tell me a little bit about you, very briefly, before we get into some of the procedures that you're currently doing. A little bit about you as a young person. You grew up, I believe, in Pennsylvania.
I did. in
Yeah, tell
Allentown,
us.
Pennsylvania.
Sorry, I was going to say, tell us a little about you that a lot of people might not know. So you grew up where? Say that again.
Yep, in Allentown, Pennsylvania. And I had absolutely fantastic parents and a great younger sister, 2 years younger than me, and a great brother, 2 years younger than her. So we were just 2 years apart. We grew up together. We're still very, very close. Um, and growing up in Allentown, Pennsylvania, which is not a big city, but it's
No.
I think the fourth or fifth largest city in Pennsylvania, which isn't saying a lot. But and my parents were religious, and they instilled their religion on us, and we continue that. But it was a great, great, great place to grow up, and from there I then went to University of North Carolina. I went there to play football, and that was 4 years in the South in North Carolina, which was wonderful. From there, I went to Chicago for 10 years of medical school and a year of research, and then 5 years of training in general surgery because all real plastic surgeons are fully trained general surgeons. So we do, and it was an interesting time, usually during Vietnam and stuff, and so we had a lot of trauma,
Yeah.
specifically in the south side of Chicago. And then from there, I went to University of Miami for my plastic surgery fellowship and training under Dr. Ralph Millard, who was world famous, invented procedures for cleft lip and cleft palate because that's what I was really interested in at the time. Um, and then I was very fortunately, I was hired and recruited to come to UCLA and be a full-time professor there, of which I was for 25 years, full-time and teaching all residents and medical students. I started a hand surgery service where a combination of orthopedists and plastic surgeons do all kinds of hand surgery where we, fingers get cut off, we put them back on, and all this type of
Wow.
situation. And all types of plastic surgery. So I've trained many, many, many surgeons in plastic surgery and influenced, I don't know, probably thousands of medical students as they rotated through my service, and they still do. Um,
Yeah.
they
That's
come now to
tremendous.
my they come to my private office now in Beverly Hills. I have two coming on Monday, as a matter of fact, to watch surgery and discuss life in
Yeah.
general. But now my private practice is in Beverly Hills, and where I'm doing mostly aesthetic surgery. Yes.
When you say mostly aesthetic, what are some of the more popular procedures that people are coming in for today? Let's say women, we can also talk men. And what's the age range, would you say?
Very interesting. I would say obviously in the new mother age, 30s, 20s, 30s, and 40s. Not new mother, but the relatively younger mothers. They're interested in either breast augmentation, breast lifts after they've been breastfeeding for quite a while. I do see young women that have very, very large breasts who are very uncomfortable and would like to have their breasts reduced. And those are actually the most, some of the, that group is one of the most grateful patients
Wow.
because they don't have these albatrosses hanging around their neck. They don't have stiff necks anymore. Their backs are sore and things of that sort. As far as a little bit on the older side, patients in their 40s, 50s, 60s, and 70s, they're interested in having their neck improve, their jowls improve. Sometimes they have tired eyes and they like to have the upper eyelid tissue improve so they have a more alert, more rested appearance.
Hmm.
And it works out very nicely. We do mommy makeovers, basically, where women have had their babies, they've had their children, and they still have this pooch, so to speak, of their tummy, and they have sagging breasts, and so we do both of those at the same time, and it works out very
Wow.
nicely. I would say that what I'm seeing mostly now are neck and jowl areas, and it works out very nicely. But the key is it has to look natural. It can't look pulled. It can't look fake. It just has to look rested. And basically, what it is that we're undermining the tissue, tightening the skin underneath, doing what we call a deep plane correction. So we're tightening these muscles underneath the skin, and then not stretching the skin, but adjusting the skin so that it's nice and easy, so it doesn't look tight, and remove the extra skin and sew it up. And patients we do this as an outpatient under local anesthesia, so it works out very
Oh,
nicely.
wow.
Yeah,
Oh, no, that would matter to me because I'm telling you, I've always looked into getting a little something and I'm like, oh, I don't want to go all the way under. But where would the scar go? Does it go under here? Does it go here? And what if you're somebody who keloids? I keloid, right? You don't want this big scar sitting here or a big one over here. And I really keloid. I'm somebody that they would look at me and go, oh, look what she just did. So that's always prevented me from coming in too. Like,
I
what are sort of the
understand.
modern techniques?
Okay,
Um,
I understand. So to answer your question, there's no shortcut, so to speak.
yeah.
However, uh, what I do and what I've taught all my residents and students is that we put the incisions inside the hair, not in front of the hairline, but inside the hair. But it does come down in front of the top part of the ear, inside the ear here, around the earlobe, and then everything else is behind the ear and back into the hairline. And what this has done is we elevate the skin, tighten these muscles underneath. And there's
Mm,
another little incision underneath the chin, so we can tighten these muscles here called the platysma muscles. And
right.
then sometimes I'll do both sides. I'm
What
kidding.
about the
I'm
what about
kidding. We do, of course, we do both sides.
yeah, no, I knew that. What about the neck? I'm so into this. I'm getting my own personal,
Good.
time with you.
Very,
This is great. I don't even have
very
to come into
good.
the office. What about the what
Well,
about the
you're
neck a little bit? How do you do that?
exactly. Well, you're in Los Angeles, so I'm just a couple blocks away from you, I would assume. I'm in Beverly Hills. So it all has to be one entire unit. It can't just be people come say, all I want is my neck done. Well, no,
That's got
you
to be
can't do
yeah.
just the neck because if you just do the neck, then you have this overhanging jowls and you look like a bulldog. So it all has
Oh,
to be one entire unit. And so the incision is made underneath the chin, along with the incisions that I just said. Sometimes we do a mini lift. You don't have to go
mm,
all the way up, but everything is one entire unit. And we tighten these muscles that are underneath here so it gives good support to your neck. Sometimes we do a little liposuction, take some of that fat out. And then everything as one unit is re-draped back posteriorly, vertically, and horizontally, so it looks nice and natural. But if it's
mm.
pulled too tight, it looks terrible.
Do you have to do the rest of your face too if you do something like that?
You don't have to do anything. And I never ever, hardly ever do the forehead at the same time. This is a lower face and neck lift.
I
And
like
again, I
that.
said that not too many surgeons do it under local anesthesia. And every time patients come and I tell them about this under local anesthesia, they said, "Thank God, because I had my knee done and my hip done under general, and it lasted. I had this cloud over my head for some time with general anesthesia. Um, but doing it under local anesthesia is fantastic. We give a couple of pills by mouth, some Valium, so that you're a little sedated. It takes me
Mm,
less than a minute to get your whole face numb, like when you go to the dentist and you get those shots,
wow.
but it's not as bad as the dentist shots. And most of the time, I'd say 80% of the time, patients are listening to my music, they're listening to my lousy jokes, and they're snoring. Uh, I would say,
Wow.
I don't know, 5, 10% might say ouch at one time when I'm putting the medicine in. And that's about it. The whole thing takes about 2 hours, 2.5 hours. Um, but it has to be done precisely and with grace and with the forethought.
What about downtime?
It's 2 weeks till you're presentable in public.
Mm,
And the whole key is that I see the patients can go home that same day, and I call that night, speak to the husband or the friend. Somebody has to be with you that night, and then you come back 24 hours later. So we take this big bulky dressing off and just put you in a chin strap. And this chin strap keeps everything, keeps the swelling down, uh, keeps bruising down, and you have to wear that for my patients anyhow, for 2 weeks, 24/7. You can take a shower and wash your hair at about the fourth day, and I encourage my patients to shower and shampoo every single day after the fourth day because it keeps the
Hmm.
stitches nice and clean. So I tell them
Oh,
that they can take this off, get in the shower. You don't have to take your clothes off, but for sure, do this. And then afterwards, put the strap back on. You don't have to put your clothes back on, but it's important to keep it on for 2 weeks. At 2 weeks, we take the stitches out, and then you're presentable in public.
wow.
I still have my patients continue to wear this strap for another 3 to 4 weeks while you're at home and at night while you're sleeping because it helps give a more permanent situation. But that word permanent is an important term, in my opinion. Nothing is permanent because
No.
what we're doing is kind of like when we tighten a belt. After a while, that belt gets a little loose. Sometimes we have to do a revision 3, 4, 5 years down the line. Say, well, I know I had this facelift 5 years ago, but now everything is set. Well, yeah, congratulations. Uh, Welcome to gravity. Welcome to age. That's what does happen. And you did mention about keloids. I just want to address that real quick. And
Yeah,
that
yeah.
is that every time there's an incision by a plastic surgeon, by any surgeon, by anybody, there is a scar. There's no such thing as no scar. But
Right.
the incisions and the scars where I just mentioned, first of all, we hide them inside the hair, we hide them behind the ear, and we hide them inside the ear. But every place that there is a scar, like around the ear lobe, there is a line, there is a scar, but we put it right in a crease. So it's almost impossible to see. And in
Wow, I
about
love that.
2 months, 3 months, you can't see these scars.
Wow, that's beautiful. Let's talk briefly about the tummy tuck, the breast lift, the mommy makeover sort of a thing. If you're just like hanging, how long is a surgery like that? I imagine you do have to go fully under for something like that. I had a friend who did that, and she had the drains, and that's once again, I'm not much for anything like that, and I thought, ooh, that's a little scary, but it's really not, right? I mean, that's sort of the natural progression of getting yourself a tummy tuck or a mini tuck and separately, let's say a breast lift. Let's talk briefly about that if we can, because I know these
Exactly.
are very popular. They're popular procedures, particularly for women, right?
Absolutely. Absolutely. And for men who've had a large weight loss too.
Right.
Especially now with Ozempic and all these medications where
Oh
people
yeah,
are losing weight, they now have loose hanging skin, and
yeah.
they feel good about themselves, but they have all this loose skin
Stuff.
and or subcutaneous fat. Um, we can't take care of the fat that's inside the belly, but we can only take care of the fat and the skin between the skin and the muscles underneath.
Okay.
And always when we do a tummy tuck, we make the incision below the panty line, and it goes from hip to hip. And we make another incision around the belly button. And so we raise all that skin up, remove that extra fat, tighten the muscles at the same time,
Yeah.
always. We always tighten those muscles because women that have had babies, those muscles have been separated. And then we redrape that skin, remove the extra skin, and sew it up. So there is a scar that is hidden by the bikini line from hip to hip and around the belly button. And at the same time, we do a breast lift. And that breast lift does require incisions around the areola, which is the pigmented part of the nipple,
Right.
straight down the middle of the breast underneath and in the crease underneath the breast. And in about 2, 3 months, those scars fade, but there's always a scar. There's no such thing as no scar. But the new shape of the breast, basically what we're doing is we're making the breast into a bra so that you don't have to wear a bra because we're
Oh,
using the skin to support the breast tissue and lift it in a particular way. If the
think.
breast is very large and the woman wants to have it made smaller, then we take out breast tissue. If it's just sagging and not very large, then we just raise the breast, but the incisions are the same. Looks like an anchor scar.
Yeah. Incredible. What would you tell people who are a little, just hesitant I guess you'd say, hey, come talk to me because I'm not pushing anything on you, right? But if you really have it in your mind that you'd like to do something, what would you like to say to our audience?
Well, I mean, if you don't get information,
Yeah,
you're never you're going to constantly think about it, your whole life. So you have to go to a few doctors. And I always
yeah.
encourage patients to go to more than one plastic surgeon and to get their opinions, just assuming that they're certified by the American Board of Plastic Surgery. It's extremely
Hmm.
important
Right.
because I see patients all the time that are dissatisfied. It doesn't mean that, anyhow. Um, but without discussion with an honest plastic surgeon, um, you'll never know. And there are many patients that come in. We tell them, they say, "Oh my goodness, it's going to be 2 weeks out of my life." Well, no, I can't. I can't afford that. I don't want to do that. Fine,
Wow.
I mean, it's not a problem. But you have to be able to afford the time and the money. This is cash basis. There's no insurance doesn't pay for this.
Mm.
Sometimes for the upper eyelids, insurance may pay after the fact. And I always tell my patients if they have this hooding of the upper eyelid, when they go to their optometrist before the surgery, they should get what we call visual field test, so that the optometrist will measure the amount of obstruction to upward gaze. And then after the surgery, then they can take that piece of paper that proves that they had obstruction, and they may get some reimbursement from their insurance.
Yes, my 86-year-old father-in-law had that. We were all sort of laughing a little bit. We're like, wait, Chester's going in for an eyelid lift? Wait,
Yeah,
how is this working out? So we were laughing about it, but he needed it. He could barely see.
of course.
Um,
Good for him.
yeah. Anything else you'd like to add, Doctor? It's been wonderful speaking with you, and you're a very, very trusted surgeon, and I know just really at the absolute top of your game, and in a very crowded field. But I think what also sets you apart is not just your compassion, but how you just don't push things on people. Another story of mine. A friend of mine is very well-known actress who's on a TV show, right? So she dragged me with her to her surgeon, and she just had like the full facelift. And I said, okay, what would you do? So of course he recommended everything. Lift this. You can't do the bottom without the top. And well, what do you think happened to me? You know me well enough by now, just from our talking. I ran out of there saying
Of
never,
course.
because again, I felt like it's either can't I just do a little? So, but he was like, no, it won't be worth your time and money. And I thought, wow, is this what happens everywhere? So it's good to know you don't do
Does
that.
not. It does not.
Yeah,
That's
it's good to
terrible.
know.
And it gives real
Yeah.
plastic surgeons a bad name. It really
That's
does.
right. And that's what I want to tell people, that you don't do that you're different, that you're so well trained in this field that you stand out. Your compassion, you really do care about the people. And it's clear that you listen. So, what would you like to add that I didn't ask you, that I wouldn't have known to ask you?
Well, I think we covered quite a bit. I must say that I'm not the only one. There are many very, very good plastic
Yes.
surgeons. Um,
Yeah.
right here in Beverly Hills, if I threw a stone out of my window, I would hit more plastic surgeons that are in many states, I would imagine. So we're the kind of the center of plastic surgery of the world right here.
Yeah.
Maybe London, maybe Paris. But my only admonition is for patients to make sure that they're seeing a real board certified plastic surgeon.
Right. That
Um,
matters.
yeah, not everything is perfect. Things there are complications. There's can be infections and bleeding and scarring and numbness and things of that sort. But that all has to be explained ahead of time. It's very rare with facelifts and neck lifts and things of that sort. Um, but no, I think I would admonish your listeners and viewers to look for a board certified plastic surgeon.
Okay, Doctor, it's been wonderful speaking with you, and I look forward to getting together with you. I really do. And people, please, how can people get in touch with you?
Well, I'm in Beverly Hills, Malcolm Lesavoy, and they can look up lesavoyplasticsurgery.com.
Hmm.
That's my website,
Hmm.
lesavoyplasticsurgery.com. That's
Hmm.
Lesavoy plasticsurgery.com. Or they can call the office 310 248 5451.
Beautiful. Dr. Malcolm Lesavoy, thank you so much for joining me and joining my audience. You've put me at ease. So I do look forward to coming in and speaking with you
Very good.
very, very much. And anyone who's curious, who wants to know more, please look up Dr. Malcolm Lesavoy, call his office, look at his website. And everybody, you can find our show about the doctor on all audio and video platforms of Deborah Kobylt Live. That's YouTube, Facebook, iHeartRadio, Apple Podcasts, just about anywhere that you look for your video or audio podcasts, you'll find us under Deborah Kobylt Live. Thank you very much for joining us, and we'll see you next time. Bye-bye.
Thank you. Bye-bye.